So hi, in today's session, I'm going to talk about some important questions from pharmacology, which are important for the FMG or even the NEET PG aspirants, because these questions usually, they are overlapping. So we are going to discuss especially the topics from general pharmacology and autonomic nervous system in these today's, and then the further chapters will be according to, or the further lives will be on subsequent chapters. So this one is mainly directed towards the general pharma and the autonomic nervous system. So I'm going to start. Good evening, Crockster. So I will be just going through the various questions, and we'll be discussing about each and every question and what are the important points around that, right? So the first question, very commonly asked and repeated a lot of times, is which of the following parameter is used to assess the rate of absorption? Which of the following parameter is used to assess the rate of absorption? Whether is it Tmax, is it Cmax, is it half-life, or is it area under curve? Which parameter is used to assess the rate of absorption? So there are all of these are important parameters, and you should know what represents what, right? Half-life? No, half-life rate ko nahi represent karta. Here, half-life doesn't represent the rate. See, the rate of absorption is with the help of Tmax. So how fast the drug is getting absorbed into the circulation, kitni jaldi the drug is getting absorbed into the circulation, that is your time taken. Kitna time liya hai for that drug to get absorbed into the systemic circulation, that is your time taken, that represents the rate of absorption. So if you look at this, there is this graph given, and here what you see are there are three parameters which are very important in the graph. This one, the top here, is your Cmax. That is the maximum concentration that has been achieved, right? Maximum concentration achieved. The time taken to achieve that maximum concentration, this one here, this is called your Tmax. Okay? And the shaded portion, the area of that graph, that is your area under curve, and that represents the extent of absorption, right? So the rate of absorption is because of the Tmax. The extent of absorption is because, or what represents the extent of absorption is your area under curve, and Cmax basically tells you the maximum level, or the maximum amount which is present in the plasma. That's the maximum concentration. So Cmax represent that and can tell you about the safety of a drug. So remember, rate is your Tmax, extent is your area under curve. ये दो important है because they come repeatedly, which represents what. So Tmax इसलिए भी ज़रूरी होता है. Suppose there are two drugs, for example, and you're giving it to a patient who is suffering from insomnia. कितनी faster एक drug action produce करेगी, the rate, that will depend some जिसको नींद जल्दी आने, whatever the medicine, if it gets to the Cmax faster, so obviously you'll prefer that clinically. अगर आप देखो तो जो medicine थोड़ा late उसका maximum concentration आता है and the effect would be later on, so you will not prefer that. So clinically इसका ये important है कि कुछ drugs का effect अगर आप जल्दी आना चाहते हैं, so the drug which acts faster, we'll prefer that as compared to the drug which reaches the systemic circulation at a later rate or a later stage. So that is the importance of the rate of absorption, right? So this is, so इस question में से, so please Tmax is your rate, and अगर इसकी जगह आता था extent of absorption, then your option would be area under curve. ये 2 points are very important from this question. ठीक है, so the next question is now, forced alkaline diuresis is effective in the management of poisoning by which of the following agents? Forced alkaline diuresis is effective in the management of poisoning by which of the following agents? So here read this one, right? Forced alkaline diuresis is effective. Cmax, no, Cmax is not same. Cmax is the maximum concentration. Bioavailability is actually the area, the whole area, extent of absorption. Kitna absorb hua hai, that is your bioavailability. Bioavailability is the amount of drug entering the systemic circulation in the unchanged form. और जब वो ड्रग मैक्सिमम कॉन्सेंट्रेशन पे आ जाएगी, जब मैक्सिमम हो जाएगा, सो दैट विल बी द सी मैक्स, मैक्सिमम कॉन्सेंट्रेशन. सो कितनी ड्रग एब्जॉर्ब हुई है, दैट टेल्स यू अबाउट द बायोअवेलेबिलिटी ऑफ अ ड्रग. इट्स नॉट द सेम. ठीक है, इट्स नॉट द सेम. ऑलराइट, सो फोर्स्ड alkaline diuresis is effective in the management of poisoning by which of the following agents? So we are doing alkaline diuresis here. ठीक है? So alkaline diuresis whenever we do, so definitely if you want to remove a drug by making the urine alkaline, the drug should be acidic in nature. The drug needs to be acidic in nature because acidic drugs can be removed with the help of alkaline urine. Right? Very good. Yes, it is phenobarbital. Excellent. So phenobarbital is an acidic drug. So always remember this rule. Acidic drug remains unionized in acidic media. Okay? AAU and BBU. Basic drug, basic media, unionized. Acidic drug, acidic media, unionized. So AAU, BBU, right? And अगर ये opposite करेंगे, acidic drug in basic media or basic drug in acidic media, that will be your unionized. And for any drug's absorption to take place, the drug should be unionized. अगर unionized रहेगी drug, it can be easily absorbed. So if you want to remove any poison, definitely you don't want it to get reabsorbed back from the urine. So you want to remove it, therefore you will make the urine more alkaline. अगर आप alkaline नहीं बनाओगे, if the urine is acidic only, then the drug has a tendency to get back into the body. फिर वापस आ जाएगी तो poisoning तो again it will be there, it won't be managed. So remember this rule. So there are few important drugs. You don't have to remember a list of drugs which are acidic, which are basic, but few important जो पहले exams में पूछे गए हैं, which are the few important acidic drugs and the few important basic drugs. So acidic drugs में aspirin is important, phenobarbital which has been asked previously, acetazolamide, phenytoin, warfarin. So all these are acidic drugs. So whenever you have to remove them by diuresis, you need to make the urine more alkaline. So sodium bicarbonate. So sodium bicarbonate is used to make the urine more alkaline, and that will help in removal of these acidic drugs in case there is a poisoning. But on the other hand, जो ये basic drugs हैं like morphine, atropine, diazepam, amphetamine, cocaine. So apart from diazepam, all of them have INE towards the end. So INE वाले drugs are basic drugs apart from diazepam. ठीक है? So they have to be removed by making the urine more acidic. ठीक है? Making the urine more acidic. So either we can use vitamin C or ascorbic acid, or we can use ammonium chloride. ठीक है? Ammonium chloride is rather more toxic, so we can prefer this one, vitamin C. ठीक है? Any route? Yes. So what you can do here is, right? Yes. So here, right? ठीक है? So acidic drugs हो गया, basic drugs हो गया, आप दे सकते हो by this, right? Yes. Now, in which of this or which of the drugs are there? अब हम अगर dialysis की बात करें, another important question जो पूछा जाता है. So they will give you a drug and they will ask you whether you can remove it by dialysis or not. So remember, there are few drugs where dialysis is not effective. ठीक है? So what are the few drugs where dialysis is not effective? So can you make out any names out of this? Is the mnemonic to remember. Avoid dialysis. So can you make out any name from this mnemonic, jo if you know any of the drugs? AVOID and dialysis. Any example that you can make out? Opioid. Yes. O say opioid. Very good. One is opioids. Then A say A say. Can you make out? A say. All right. I'll tell you. A say it is amphetamines. ठीक है? V say can you make out? No, not vancomycin. No, not vancomycin. V say it is verapamil. ठीक है? Amphetamines, verapamil, opioids. I say imipramine. It's an antidepressant, tricyclic antidepressant. Imipramine. D say it is digoxin. Another D, you remember benzodiazepines का D capital या diazepam you can remember. ठीक है? So benzodiazepines में. So these are the drugs where the dialysis is not effective. So remember these drugs. So they can ask you all of drugs. These drugs can be removed by dialysis except ज़्यादा पूछते हैं. So any of these drugs if it is given in the question, then you say the dialysis is not effective. ठीक है? And yes, soda bicarbonate is given by IV. I told you yes. ठीक है? That is given by IV route. Now let's go to the another important topic. अगर हम poisoning की ही बात कर रहे हैं, so what are the other important antidotes that should be known? ठीक है? Antidotes which should be known, and these are often asked. One or two or three are definitely asked in any of the exams, right? So which are the antidotes that we should know? So let's do quickly the antidotes. For organophosphate, what is the antidote for organophosphate poisoning? Antidote for organophosphate poisoning. It is atropine. ठीक है? Organophosphate poisoning, very good. At atropine, and then we use pralidoxime. But pralidoxime should not be used for carbamates. It should not be used for carbamates. Then for the atropine poisoning, so whether it is written Dhatura, whether it is written belladonna, or whether it is written atropine, it is one and the same thing. So poisoning, yes, very good. It is physostigmine. Excellent. For digoxin, it is digibind or digifab. ठीक है? No, not for digoxin के लिए नहीं. It is digibind, specific, the antibody monoclonal antibody which has been made to remove digoxin. All right. Beta blockers, this is glucagon. ठीक है? Beta blockers का है glucagon. Benzodiazepines का flumazenil. Morphine, naloxone. Morphine is naloxone, right? Methanol or ethylene glycol. The antidote is fomepizole. ठीक है? Some books, we can also use ethanol. But if the choice is given, actually prefer fomepizole. अगर नहीं दिया, then you can always write ethanol. right? But if it is both are given, then prefer to write fomepizole. Tricyclic antidepressants or salicylates, we use sodium bicarbonate. Sodium, हमने कहा कि they are acidic drugs, right? We just did imipramine, it's a tricyclic antidepressant, and aspirin is also a salicylates में, which are acidic drugs, so they can be only removed by giving sodium bicarbonate. Paracetamol, N-acetylcysteine, right? Paracetamol is N-acetylcysteine. Okay, coming to the next group of drugs here, heparin. Heparin, we give protamine sulfate, right? For heparin, we give protamine sulfate. For warfarin, we give vitamin K, right? Vitamin K for warfarin. Apixaban, rivaroxaban. So when they have XA, so they are factor XA inhibitors. Okay? So andizanet alpha. This is also has XA, iske name mein, in the spelling. Andizanet alpha, and that can be used for overdose of apixaban or rivaroxaban. Dabigatran, we have a monoclonal antibody, idarucizumab. Okay? Idarucizumab. So these have been asked before. All of them have been asked before in the exams. Cyanide poisoning. For cyanide poisoning, either we give a vitamin B12 or we give hydroxycobalamin, or we can also give amyl nitrite, amyl nitrite plus sodium thiosulfate. Amyl nitrite plus sodium thiosulfate. Methotrexate, leucovorin or folinic acid that you call. Folinic acid, leucovorin, anything that you can use. Arsenic or mercury. For arsenic or mercury, we use dimercaprol. Arsenic or mercury, dimercaprol. Lead के लिए we use dimercaprol plus calcium EDTA. ठीक है, plus calcium EDTA. So ये कुछ important antidotes हैं and the poisoning which really are important, and they should be actually on your fingertips. So to know this is almost a lot of antidotes they get covered here. ठीक है? That is important for now. Now coming to the next question, which is loading dose of a drug depends upon. Loading dose of a drug depends upon volume of distribution, clearance, half-life or duration of action. Loading dose of a drug depends upon volume of distribution, clearance, half-life or duration of action. So loading dose of a drug. So remember that loading के spelling में, because there usually a confusion होता है whether it is volume of distribution or whether it's clearance. So remember, loading has a D in this and volume of distribution also has a D. So loading dose of a drug depends upon its volume of distribution. The formula for loading dose is the plasma concentration multiplied by the volume of distribution. The second one जो होता है, that is your maintenance dose, where the plasma concentration will stay as such, but it depends upon the clearance. This is also an important question, like maintenance dose depends on what? Maintenance dose depends upon the clearance, loading dose depends upon the volume of distribution. So remember, these two are important to know. So note this. So D in loading dose and D in volume of distribution. So that you can remember. Loading dose means that when you want to give, for example, like for certain drugs, I'll take the example of chloroquine. So chloroquine is an anti-malarial drug. Now anti-malarial drug देने के लिए, now chloroquine का क्या होता है? Chloroquine has a very long half-life. And you know that it takes about 4 to 5 half-lives for a drug to reach its steady state concentration, or that concentration जहाँ पे the action will be, the therapeutic action will be there. तो 4-5 half-lives लगती है. So for example, let's say chloroquine को 4 to 5 half-lives लगेगी. For example, it takes about 4 to 5 days to reach that steady state concentration. Now chloroquine is used for malaria, and you have to bring down the fever in the patient. You cannot wait for 4 to 5 days to bring down that high grade fever in the patient. So what you do is you give those doses together. You give a large amount of dose so that that steady state concentration or that therapeutic concentration is achieved quickly. It is achieved quickly because you want to get or bring down that fever as soon as possible. So this is for certain drugs who have either a very long half-life, whether they have a long volume of distribution, so बहुत long half-life है, and you cannot wait for long for their actions to occur. So for example, emergency drug कोई भी है, like digoxin है, 40 hours की half-life है, and if you want to give it for heart failure patients or any other conditions where you want to use it immediately, इसका action आना चाहिए. 40 hours means 4 to 5, half life 40 hours है. So 4 to 5 half lives मतलब 40 into 4 कर लो. So it'll take that much time to reach its steady state or therapeutic concentration. We can't wait for that long. So what we do, we give a large amount of dose together, and so that steady state concentration is achieved faster. ठीक है? So ये steady state concentration. So for example, ये आपने drug दिया and इसका ये steady state concentration आ गया. So ये steady state मतलब होता है basically that is your therapeutic concentration where the actual action will come. So ये drug है, ठीक है, इसकी actual ये concentration है और ये dose है. So ये जो concentration achieve हमें करनी है because we want the therapeutic concentration. तो इस concentration को achieve करने के लिए हम big amount of dose देते हैं drugs का ताकि ये फटाफट ये concentration achieve हो जाए. That's called as the loading dose. And once this concentration is achieved, फिर हमें क्या करना है? We have to give smaller doses so that it stays in this. ये ऐसे ही रहे, इसकी fall ना करे concentration जब तक हमें effect चाहिए. So we start giving maintenance dose to maintain this level. And that to maintain this level, this is called as maintenance dose. And आप कैसे calculate करोगे maintenance dose? By this formula. Plasma concentration into clearance. So this is the concept of loading and the maintenance dose. So these are some important formulas which can be asked, or they can give you values and you have to take out the different like let's say calculate the bioavailability. So bioavailability का formula है area under curve of by oral route divide by area under curve of the same drug by the IV route. So your values would be provided to you and you just have to put these values and get the answer. Nothing complicated. So they'll give you the values. You only should be knowing the formulas. That is what is important. You have to memorize the formula so that you know कि आपको कौन सी चीज़ कहाँ पे put करनी है. So volume of distribution जैसे है, आपको dose दिया हो सकता है, bioavailability दी हो सकती है. You just have to put the values divide by the plasma concentration. ठीक है, that is what you do. Half life को your maybe your this volume distribution is given, clearance is given, and you just have to substitute. So all these are important. You can take a snapshot, and these are important formulas which you must know from the general pharmacology, pharmacokinetics basically. They are very important formulas, and either they ask you as such, what does half-life depend on, what does loading dose depend on, what does maintenance dose depend on. So only if you know the formula you can make out, or you can answer what they depend on, right? So you can take this. Then the next important thing is kinetics of elimination. Another important aspect in pharmacokinetics are your first order kinetics of elimination. So in the first order kinetics of elimination, what is true? A constant amount of the drug is eliminated, a constant fraction of the drug is eliminated per unit time, or the rate of elimination is independent of the plasma concentration, or rate of elimination depends on the plasma half-life of the drug. What does first order kinetics mean? Which is the true statement? Which is the true statement? So in the first order kinetics, first starts with an F, okay? So a constant fraction of the drug, this one, a constant fraction of the drug is eliminated per unit time. No, it is this constant fraction of the drug is eliminated per unit time. Constant fraction is proportion. Rate of elimination will depend, actually the fourth में the problem is the rate of elimination, it depends on the plasma concentration, not on the half-life. So यहाँ पे होना चाहिए था rate of elimination depends on the plasma concentration of the drug. Then it would have been correct. But here the clear-cut winner is a constant fraction of the drug is eliminated per unit time. That is first order kinetics. And what are the major differences between the first order and the zero order kinetics? What are the major differences? So there are constants. क्या चीज़ constant रहती है first order में? क्या चीज़ constant रहती है in the zero order? That you should know. So three things are constant here in the first order. You should know the first order and उसका opposite will be true for the zero order. So therefore remember for the first order and the opposite will happen for the zero order. For first order, the first constant is the fraction, as we did. A constant fraction of the drug is eliminated. Whether it is 20%, 30%, 40%, 4%, some constant fraction eliminate होएगा per unit time. ठीक है? दूसरी चीज, what is constant is your half-life. The half-life is constant in the first order kinetics. Right? The third constant is the clearance. So these three things are constant in first order kinetics, right? And what is not constant is your elimination, rate of elimination. Rate of elimination is directly proportional to the plasma concentration. So there are three constant and one is not constant. And the opposite is going to happen in zero order. ठीक है? So constant इसमें एक क्या चीज़ रहती है इसमें? Amount होता है. Not the fraction but the amount. So fraction F first में है तो इसलिए fraction होएगा. For the zero order it is a constant amount. The O here and the zero here. The constant amount is eliminated. Now let's do the opposite here. Zero order में half life is not constant. It is variable, not constant. Clearance is not constant. Opposite होना चाहिए. So clearance is not constant. It is inversely proportional to the plasma concentration. ठीक है? As plasma concentration ज़्यादा होएगी तो clearance कम होएगी इसमें. Inversely proportional. Now because elimination is not constant in the first order, it is constant here. So they have the rate of elimination is constant. So these are the four important differences that you must know about the first order as well as the zero order kinetics. And most of the drugs, they follow first order kinetics. It's a good kinetics. First आना हमेशा is good. So first order is good order kinetics, while the zero order is the bad kinetics, as we say. And very few drugs follow this. And most of drugs, what will they do? जब वो normal therapeutic range में है, they follow the first order. But as soon as you give very high dose of this drug, then they follow zero order. Right? Then they follow the zero order. So few drugs. Only few drugs follow this zero order. And you can remember this by 0 watt power. 0 watt power is the mnemonic to remember drugs which follow the zero order kinetics. Okay? So W is for warfarin. A is for alcohol. Then you can remember most important is tall butamide here. Tall butamide you can remember here. Let me write it a little upper. P, power का P is your phenytoin. ठीक है, warfarin, alcohol, tall butamide, phenytoin are the most important drugs to be remembered for the drugs following zero order kinetics. ठीक है, so they all follow zero order kinetics. ये important हो गया for the first order as well as the zero order. Now let's come to the next topic, which is the CYP450. Now, CYP450 enzymes most commonly involved in the metabolism of drug is. Which of the CYP enzyme is most commonly involved in the metabolism of drugs? Out of these 3A4, 1A2, 2E1 and 2D6. Which of this is the most common CYP involved in the metabolism? Very good. It is the CYP3A4. 50%, rather more than 50% of the drugs are metabolized by CYP3A4. Okay? So, we don't have to remember the substrates, all the substrates for these, but the important substrate, because ये maximum, this is for most of the drugs. Most of the drugs. पर इसमें भी ज़्यादा important अगर आपको याद रखने हैं, so these are your statins, ठीक है, and your oral contraceptive pills. Then we have terfenadine. These are more important to remember. CYP 1A, 1 or 2, इसमें important है theophylline. CYP 2E1, paracetamol. Paracetamol converts to napqui. ठीक है, paracetamol converts to napqui because of this CYP2E1. CYP2D6. So इसमें drugs for the heart, that is your beta blockers and antiarrhythmics, and drugs for the brain like your tricyclic antidepressants. ठीक है, tricyclic antidepressants. और क्या है इसमें SSRIs and opioids. These are the important substrates for 2D6 for the heart and the brain. CYP2C9, इसमें एक दो important है बस, phenytoin, warfarin. CYP2C19, इसमें clopidogrel and proton pump inhibitors. These are the two important. So इनके आपस में interaction होता है. So proton pump inhibitors, they inhibit the activation of clopidogrel. So जिन patients को clopidogrel चल रहा होता है, it's not recommended to give especially drugs. जो हम omeprazole and all देते हैं, not recommended to give the drugs. ठीक है, so these are the important CYP enzyme substrates to know. And another important thing इसमें आता है enzyme inducers and enzyme inhibitors. जो names हैं, we don't have to go with the details. The enzyme inducers के important names कौन कौन से हैं? So जो names के लिए एक mnemonic है, which are the drugs, which is get PCR. ठीक है? Get PCR एक mnemonic है to remember which are the various enzyme inducers. So G से आता है आपको ग्रीजियोफल्विन. ठीक है, ई से है इथेनॉल. क्रॉनिक एल्कोहलिक्स जो होते हैं, जो क्रॉनिक पी रहे हैं, तो it becomes, ethanol becomes on chronic use, it becomes a enzyme inducer. T से है tobacco smoking. Again, tobacco smoking is leading to enzyme induction. ठीक है. P से very important is your phenytoin. ठीक है. That is an anti-epileptic drug. Carbamazepine, another anti-epileptic drug. And R से very important potent enzyme inducer is your rifampicin, which is an anti-tubercular drug, very important anti-tubercular drug. ठीक है. So these are the important enzyme inducers, and you should know which ones are these. So ये एक mnemonic है to remember the enzyme inducers. So another one is enzyme inhibitors, and to know which are these enzyme inhibitors, एक और mnemonic है vice captain Kohli. So this was made when he was a vice captain. So इसमें आप ये vice captain Kohli, ये आपको याद दिलाएगा which are the various enzyme inhibitors. ठीक है. So V से आएगा आपको valproate, another, ये अभी anti-epileptic drug है, but this is an enzyme inhibitor, unlike phenytoin and carbamazepine और phenobarbitones, वो सारे inducers हैं. Valproate is an enzyme inhibitor. I से isoniazid, ये भी एक anti-tubercular drug है, rifampicin inducer है, isoniazid inhibitor है. C से cimetidine, this is a H2 blocker, ठीक है, which is not used now because it has the problem of causing Torsades de pointis, heart arrhythmias है. cimetidine use नहीं करते, अब हम ranitidine, famotidine वो वाली drugs use करते हैं. But cimetidine is an example of an enzyme inhibitor. ठीक है. E से erythromycin, which is your macrolide antibiotic. ठीक है. erythromycin is a macrolide antibiotic that you can remember. Then C से it is another antibiotic, ciprofloxacin, a fluoroquinolone. And K, Colica K, is your antifungal, ketoconazole. Vice Captain Kohli. So Vice Captain Kohli is a mnemonic to remember the enzyme inhibitors, while enzyme inducers can be remembered by the mnemonic of get PCR. ठीक है. So you remember these mnemonics, and this will help you to remember कौन से inducers है, कौन से inhibitors है. तो exam में अगर आता है कि which one is inducer inhibitor, you can make out. ये important वाले इसलिए because they have been asked frequently, so you should just know about them. Okay, the next one. Prescription drugs are included in which schedule? Is it H, Y, P or X? Prescription drugs are included in which schedule? Schedule H, schedule Y, P या X? So prescription drugs means that you can only get it with the help of a prescription only. You cannot get it without a prescription. So prescription drugs basically are included under schedule H. ठीक है. schedule H. तो थोड़े से important schedules हैं, 3-4 which are important to know. Schedule H है which deals with the drugs which can be sold only under prescription, only by prescription. We cannot get it without a prescription. Then schedule G. Schedule G का मतलब क्या होता है? Schedule G means that they have to be used only under medical supervision. The difference in H and G is only prescription, पर उसमें supervision is not necessary. G has to be under medical supervision. Schedule X. These are actually the drugs you need a license, so they cannot be stored even with any medical, the chemist or the drugstore. you have to get a license for this, so that it can be taken, like hospitals usually somebody has a license and then only they can procure, and they have to be kept under lock and key. These are psychotropic drugs like morphine and all, so they need to be, they are very, you cannot use them, and license is required for keeping them or procuring them. Schedule Y, it deals with the clinical trials. Why? Why means why are you doing this? Why are you giving it? So you need a trial to prove that this drug is effective. So Y is basically all these, regarding all the regulations and everything of the clinical trials. And now because in this option in the question there was P given, otherwise it's not very important to know, but because this question mein P diya tha, Schedule P. Schedule P is basically, it contains the regulations like regarding the storage and how the, kitna life period hai uska, kitna shelf life hai, so knowledge about that. So the first four are more important. P is not that much important, but the first four are important. So H, G, X and Y. Now Schedule X, do not confuse it with the teratogenic जो drug category X है, वो different है. Schedule X is different, those categories are different, those are teratogenic categories, A, B, C, D जो भी X है, and that is different from this. ठीक है, no confusion in that. Alright, let's move on to the next one. Which of the following statement is true for a non-competitive inhibitor? Which of the following statement is true about a non-competitive inhibitor? Whether it is only decreasing the Vmax, whether it is only decreasing the Km, whether it is decreasing both Vmax as well as Km, or it is decreasing in the Vmax but there is no change in the Km. Okay, so Vmax, maximum velocity, and the amount of the drug which is required, that is basically to bring out 50% of the maximum response, is your Km. So जो आपका non-competitive inhibitor है, what is the true statement regarding that? ठीक है, so let's say ये आपका without any competitor, this is a drug which is without any competitor. Very good, it is decrease in Vmax but no change in the Km. Excellent. So ये है without any competitor. Then there is, अगर आपने एक competitive antagonist साथ में दिया, then what will happen? The Kmax will go a little here, but Vmax will be same. So competition है, तो competition में थोड़ा जोर लगता है, so the Km, ये जो dose है थोड़ी सी ज़्यादा इसको ज़रूरत पड़ेगी, but the maximum response it can achieve, it has the capability to reach the maximum response. This is with a competitive antagonist. And if you talk about the non-competitive, जिनमें competition का ही they have no scope of competition, so the Km does not change. ठीक है, ये non-competitive है, the Km does not change but the Vmax drops. ठीक है, so the Km remains the same but the Vmax will drop. ये Vmax same and ये Vmax drop. So non-competitive, decrease in Vmax but no change in the Km. अगर competitive inhibitor होता, then Vmax is same, but what about the Km? The Km will be more. ठीक है, so they need a lot of because Km क्या होगा? What about the Km? They require more dose to achieve the same response. ठीक है, so that will happen here. Now, another graph which is given in some of the exams, sometimes they give you this Lineweaver-Burks plot, and then they will only show you the graph and they will ask you to identify whether this is a competitive inhibitor, whether it's an uncompetitive inhibitor, or whether it's a non-competitive inhibitor. So you don't have to know in details about this graph, only identify what graph signifies what. ठीक है, so easy to know. Competition जो है, competition में C आता है, C is for cross. So जिस ग्राफ में क्रॉसिंग हो रही होगी, that is for competitive inhibitor. Uncompetitive में U आता है, so either you can make this looks like a U और parallel भी है, but it looks like a U. So जो ऐसे U shaped ग्राफ आ जाता है, that is your uncompetitive inhibitor. And the last one is, which is left, is your non-competitive inhibitor. It looks like a V basically. A non-competitive inhibitor looks like a V. So अगर आपको पता है कि competition का graph C है, it will cross. Uncompetitive is looks like a U. So the one which is left, which is V, is of a non-competitive inhibitor. Nothing more to know in this. और कोई detail इसकी करने की जरूरत नहीं. Only just identify which graph is what. That's what at the most you are required to know. Okay. Okay, now let's go on to some of the questions from the autonomic nervous system. So these were some from the general pharma, so some of the autonomic nervous system questions. Which of the following is not an adverse effect of Rytodrin? Which of the following is not an adverse effect of Rytodrin? Whether it is hypoglycemia, hypokalemia, tremors, or tachycardia. So, Rytodrin is what? First, you should know what is Rytodrin. No, it is no. Rytodrin is a beta 2 agonist. ठीक है? Tocolytic drug, beta 2 agonist. So beta 2 को stimulate करने से what are the effects which can come? That you should be clear of. So beta 2 को stimulate करने से, remember, I'll come to this question later. Let's see what happens. अगर आप major adverse effect of beta 2 याद करने हैं, so क्या क्या हो सकता है? ठीक है? 3 T's and 2 H, you can remember like that. So T से एक T is tremor, एक T is tachycardia, 1 T is tolerance. ठीक है? Tremors, tachycardia, tolerance. ये हो गए T वाले adverse effects as such. H से 1, it is not it will can cause hypokalemia. पहले होता है hyper, then it is actually hypokalemia prolonged, and it can cause hyperglycemia because of glycogenolysis and gluconeogenesis. So 3 T's and 2 H here. तो इसमें से अब देख लो कि कौन सा जो इफेक्ट है which is not there. Hypoglycemia, hypokalemia, tremors या tachycardia. So which of the adverse effects is not seen with Rytodrin? So you have to know here what is Rytodrin, and then you can mark from what I have told you 3 T and 2 H में से कौन सा नहीं मैच कर रहा है. इसमें से hypoglycemia मैच नहीं कर. It is hyperglycemia and not hypoglycemia. ठीक है? So this is the important question from this, right? Beta 2 agonist के बारे में, these are the things. So you should know this one. Right? ये important. So next question from ANS. Farmer with OP poisoning, organophosphate poisoning. He was treated with IV atropine and pralidoxime. After that, he presents with hypothermia. What could be the reason for this present complaint? What could be the reason for the present complaint? Whether it is the OPC poisoning, whether it is the side effects of pralidoxime, whether it is the side effects of atropine, or is it aspiration pneumonia? क्या हो सकता है इसका रीजन? हाइपोथर्मिया. बेटा tremors and tachycardia. Tachycardia is because of the action on beta 2 भी है ना. They can beta 1 पे भी act कर सकते हैं, 2 पे भी act कर सकते हैं, because they are more selective. हम इसलिए कहते हैं कि at low doses they are selective, but they can also cause if you give it a high dose, then tachycardia occurs. Low dose पे selectivity होती है, high dose पे selectivity नहीं होती है in pharmacology, in anything. So low doses पे if you give, it will not cause, but if you give it a high dose, it will definitely cause tachycardia because it will also now stimulate beta 1 receptors in the heart. Okay? And tremors are because of the action on the skeletal muscles. Beta 2, they are present on the skeletal muscles, and when they get activated, there is firing, rapid muscle firing, and जो उसमें contractions होते हैं, they are not proper. So that leads to tremors. So tremors is a very, very important side effect which you must know for beta 2 agonists. And tachycardia at high doses. Okay? So remember, tachycardia at high doses, but tremors can occur even at the normal doses. That is the reason. Okay, you said third, very good. Side effects of atropine. Excellent, excellent. Side effects of atropine. And so what are the other side effects of atropine that are there? These side effects पता होना चाहिए. Dry mouth. And dry mouth because it causes decrease in all the secretions, right? Blurred vision, mydriasis. So it is not, अगर narrow angle glaucoma है तो absolutely contraindicated. Any kind of drug which causes mydriasis should not be given in glaucoma patients. Urinary retention, so it should not be given in patients of benign hypertrophy or prostate. Constipation decreases the intestinal movements. Hyperthermia. Now, what is the reason for hyperthermia basically here? It is the decrease in the sweating. Okay? Because it decreases all the secretions of the body, so it decreases the sweating, and that leads to hyperthermia. Now, because of this hyperthermia, it is contraindicated atropine in children. Okay? Because it can lead to dangerous rise in the temperature and the child can die. So, it is contraindicated in children, and this hyperthermia is called as atropine fever. Okay? Atropine fever because of hyperthermia, and the reason is decrease in the sweating that it causes. Then it can lead to delirium. But ये most important है hyperthermia. ये पहले भी 2-3 बार this question has come. So it can be either a patient or a child which had come in last FMGE, I think, and even in the NEET PG, that child was playing with some plant and he consumed the plant and he developed like hyperthermia. So he consumed that datura plant, so likha tha. So datura is atropine only, and there was signs symptoms were given. One of symptoms was hyperthermia. So you can make out that this is the atropine poisoning, and it was asked like what is the antidote for that. Antidote is physostigmine. So in that ways also it can be. So atropine is again very, very important to know, whether it is asked in this form or the other form, right? All right. Next is the renal dose of dopamine. What is the renal dose of dopamine? What is the renal dose of dopamine? And by the question means ki on which dose we give dopamine's doses are dose effects are dose dependent, right? Uske effects jo hain, they are dose dependent. So on what dose does it affects the renal, let's say the blood vessels or the renal vessels? So renal dose of dopamine. So dopamine, if given in low doses, it has an effect on the renal blood vessels. So low dose jo hai, this is your first 2 to 5 micrograms per kg per minute. Okay? So because it acts on what receptors? Dopamine 1 receptors in the renal vasculature. So it will lead to vasodilatation and enhance the GFR. Okay? So it is used for patients of shock with oliguria, decreased urine. Okay? It is used for the treatment of patients who have shock along with oliguria. Then you slightly increase the dose 5 to 10. Then it acts on the beta 1 receptors in the heart, and that leads to tachycardia or increase in the heart rate, increase in the force of contractions, right? And this can be helpful in the patients of congestive heart failures. Then if you go above this dose, 10 to 20, then it will act on the alpha 1 receptors leading to vasoconstriction, and then it can increase the blood pressure. So we don't usually use very high doses. The mostly therapeutic dose हम इसी के अंदर काम करते हैं. So its response or actions are dose dependent. सबसे low dose is on D1, then B1, and then alpha 1. That is what you should know about dopamine. Okay, and it's the drug of choice in shock with oliguria. Okay, so shock with oliguria, we use this. Now the next one is match the dilution of adrenaline. Again, adrenaline is a very, very important topic to know. Match the dilution of adrenaline and its use. Match the dilution of adrenaline and its use. So 1 is to 1000, 1 is to 10,000, 1 is to 2 lakhs. So 1 is to 1000 is used in management of anaphylactic shock. Okay, so you give it by the intramuscular route. 0.5 ml IM 1 is to 1000. Okay, this is absolutely important, very important to remember. Then 1 in 10,000. So 1 in 10,000, 1A, no, 1 is C. Okay, 1 is C. 1 in 10,000 is used for cardiac arrest. And 1 in 10,000 is also used for epistaxis. ठीक है, bleeding अगर होती है, local bleeding, compress of 1 is to 10,000. 1 is to 2 lakh to 1 is to 80,000 we use along with the local anesthetic as a vasoconstrictor. So all these dilutions are very, very important to know. But this is the most important dilution. Okay? Anaphylactic shock, the dose 0.5 ml, 1 is to 1000 by IM route. Absolutely mandatory to remember. Okay? It's a crime if you don't remember this. Then mention the uses of adrenaline. So you should know the uses, important uses of adrenaline. उसके लिए एक mnemonic है A, B, C, D, E. ठीक है? A, B, C, D, E. A is for anaphylactic shock. B is for bronchial asthma. C is for cardiac arrest. D is for, you can write delay. You can write its duration of action or delay the absorption, or we can write duration. Rather, we can write duration of action. So it increases the duration of action of local anesthetic. E is for epistaxis. Duration of action actually तभी बढ़ता है when it delays its absorption, because it's a vasoconstrictor. It acts as a vasoconstrictor. It delays the absorption of the local anesthetic into the systemic circulation. So these are the important uses of adrenaline. Very, very important to know. And this one of utmost important than even this. Okay? So these are the important uses of adrenaline. All right. The next question we can do is a 20-year-old male patient. He visits a center to quit tobacco, which he has been consuming for quite some time. Which of the following drugs can be prescribed to him? ठीक है? So he has come to quit tobacco. Smoking quit करने आया है. And which of the following drugs can be prescribed to him? कौन सी ड्रग हम देते हैं for cessation of smoking or smoking quit कराने के लिए which of the drugs can be given? Alright, so इसमें हम पहले answer पहले let's see which are the drugs given and then we come to the answer. So again there is a mnemonic for this. 4, very good, yes, 4. So mnemonic क्या रख लेंगे इसमें? Very nicotine pro. Very nicotine pro. Very से आगे लगा लो, it is varenicline. Nicotine is nicotine as such. Pro आपका हो गया bupropion. ठीक है, varenicline, nicotine, bupropion. ये 3 drugs हैं which have been approved for smoking cessation. ये आपको 3 drugs याद रखनी है, any of them. So again this is a very very important drug to remember. Now coming to the last question. An elderly patient with a history of bronchial asthma, he developed glaucoma and was prescribed a drug for glaucoma. After using that drug, his asthma worsened. Second year uni exam. ऐसे ही पढ़ो. How to study is like book से पढ़ो and then go and solve questions and then that's how you know. You have to have a standard textbook. उसको लो, standard textbook से पढ़ो and once you do that, then go through these questions. ये important questions हैं और इन्हीं questions को MCQ के तरह करने के बजाय इसको अगर आप डिटेल में पढ़ोगे, जिसमें आपको बता रही हूँ एक क्वेश्चन लेके and I'm discussing the important points around them. That is how you know. ठीक है. 3, very good. It is timolol. Timolol is a beta blocker, non-selective beta blocker, and therefore it has an effect on the beta 2 receptor which is present in the lungs. And normally beta 2 stimulation causes bronchodilation, और अगर block करेंगे that will lead to bronchoconstriction. It can worsen the asthma in the patient. That is your choice. I cannot, that's totally up to you. Rather choose a textbook first. ठीक है, पहले textbook first करो, choose. If you have the textbook right, whoever you choose out of them is totally fine. ठीक है, but you have to first have your base strong. खुद पढ़ोगे then only you can go to whatever platform you want to go. But the problem is that आपका base strong होना चाहिए. Otherwise nobody can help you. It's not just the teacher, it's your own effort also. So you have to have a strong base. So first वो ठीक करो. Overwhelming definitely are there. So you go with any. They're all good, right? They're all good. The only thing is आप कितना effort डाल रहे हो. They are going to just give you pointers here and there and maybe they practice. ठीक है? But ultimately तो आपने ही मेहनत करनी है. ठीक है. So adverse effects of drug used in glaucoma. They can precipitate asthma. ठीक है. And they can cause blepharoconjunctivitis. Blepharoconjunctivitis. Latanoprost. Iris pigmentation. And growth of eyelashes, which causes hypertrichosis, and the iris pigmentation, which is heterochromia iritis. Heterochromia iritis. ठीक है? That is latanoprost, prostaglandins. Adverse effects of apraclonidine, the most important is lid retraction. ठीक है? And it can cause apnea in newborn. Apnea in newborn. Therefore, it is contraindicated in children less than 2 years. में. Acetazolamide can cause corneal edema. Letrozole, which is a new drug, Rho kinase inhibitor, can cause redness in the eye or hyperemia of the conjunctiva. Epinephrine, it can cause conjunctival pigmentation. Conjunctival pigmentation. Okay? So iris pigmentation is caused by latanoprost, but the conjunctival pigmentation is caused by epinephrine. Okay? So these are some of the important topics or important questions which have been asked in previous exams, the previous MCQs, and the important other around them, the other discussion or the other important thing you should know about these topics. So what you should do whenever you're trying to revise any previous MCQ, only उस MCQ को रट्टा मार के that doesn't solve the purpose. You have, the topic is important. So around that topic, you should actually revise and discuss. That is the whole point of revising MCQs. Only PYQ revision or discussion, that's the important thing, is not only the PYQ you should know, but that when the PYQ has been asked, you know that now this is the important topic and has a probability of being asked again in the future. So they can ask anything else about that particular drug. So you should know everything or the important things around that drug, right? So this is all about the today's session, and I'll see you next time, and take care till then, and have a great evening. Keep studying. All the best.